I personally suffer from arthritis. I've suffered from arthritis all my life, and the main reason is I have what's called early post-traumatic arthritis. When I was young, I was involved in a motor vehicle accident. I was run over by a bus and it mangled my knees. Both knees were badly damaged. My joints were deformed. They were damaged. I had open fractures. They became infected. I've had numerous procedures to improve the alignment, just to help me walk. But over the last 10 years, the pain got worse. I noticed that my motion was not as good. And my flexion extension of my knees diminished. I was getting weaker. I was having more pain. So as an orthopedic surgeon, with this going on in my life every day, I thought I really need to look at options for treating arthritis. And because I'm in a field that I can't really be off for months at a time, I felt that it was smarter for me to look for non-surgical options. I can certainly have a knee replacement, but because of my deformities, my knee replacement will be very complex, and it may even lead to complications. And I really can't afford having complications as a father with children, having a job. I can't afford that. So I think that's similar thinking of my own patients. Many of my patients have that same sentiment. They work, they really don't want to have a knee replacement, they have arthritis that's affecting their lives, so what options are there? Well, I've been thinking about this for many years, and I've been doing research, and I've been learning from people that are already doing it. And what I've come to know is that there are other options for treating arthritis, including platelets, hyaluronate injections, different types of therapies, including active release therapy, deep tissue work, yoga. And then there's, of course, different types of surgeries that are minimally invasive, which I actually, which are part of my algorithm for treating arthritis. But the most exciting component of the treatment of arthritis for me is regenerative medicine options. So regenerative medicine, what does that really mean? Or what does that include? For the most part, I think everyone's heard, or most people have heard about platelet-rich plasma. Very common procedure. It's been done now probably for about 15 years, at least in mainstream clinical practice. Platelet-rich plasma. What does that mean? That's a procedure where we take your own blood. It's a simple blood draw. We spin the blood numerous times in a centrifuge, high speed, maybe 15 minutes, maybe multiple spins, and we concentrate the platelets that are in your blood. What we've learned over the last few years is that platelets do more than just stop bleeding. They actually release cytokines. They can activate stem cells, or specifically mesenchymal stem cells, and promote healing. So it's very commonly used regenerative treatment option, which I have actually had done on my knee. The other treatments that you'll be hearing about more and more are adult stem cell treatments. And these are treatments where we are able to harvest mesenchymal stem cells, which are cells that have the ability to convert into muscle, ligaments, cartilage, but more importantly is that they release these bioactive substances that can promote injury healing and are anti-inflammatory in and of themselves. So these cells can actually help people who have knee pain from arthritis or from injury. So we have bone marrow-derived stem cells, and more recently we have fat-derived stem cells in the form of a procedure called lipogems. So with this technology of regenerative medicine, people like myself who are active, who are really not ready for a knee replacement, have options. And these are good options that help possibly extend the longevity of an arthritic knee to the point that one may not need a significant surgical procedure like a knee replacement. And that's where I'm at. I'm in that same boat as my patients. I have skin in the game, so to speak. I don't want a knee replacement. I'm active, And I've learned through the field that I'm in that there are other options. So to me, that's very exciting. I'm in the center of regenerative medicine, learning about it, implementing it, following my patients. And it's given me hope with my own knee that there's something out there that might be able to help me so that I don't have to have a knee replacement right now. And I'm really happy about that. And that's why I'm excited and I do practice regenerative medicine.